For residents of Union, New Jersey, living with chronic low back pain can feel like a dead end when other treatments fail. What if the right spine procedure could address the damaged disc while preserving motion for selected patients? The answer is in a procedure that preserves your spine's natural motion, unlike a traditional fusion. Working with your body's mechanics this way can also mean a significantly faster recovery time. We will break down lumbar disc replacement, who it's for, and the vital questions you must ask a specialist. So, what is the foundational difference between these two major types of spine surgery? Spinal fusion is the conventional method. It works by permanently joining two or more vertebrae together, which stops motion at that level. Lumbar disc replacement, or LDR, takes a different path. The surgeon replaces a damaged disc with an artificial implant that mimics the original. This single distinction, stopping motion versus preserving it, is the basis for all the potential benefits that come next. Because it doesn't wait for bone to heal, LDR often means a shorter hospital stay and can be done with minimally invasive techniques. Now let's go back to the idea of protecting your spine for the future. How exactly does preserving motion accomplish that? When a spinal segment is fused, it can't move. The stress of motion transfers to the discs directly above and below the fusion. This can cause them to wear out faster. By preserving motion, an artificial disc distributes that stress more normally, reducing stress on nearby discs for selected patients. This focus on long-term function is a major reason why studies often report higher patient satisfaction rates with LDR. With these potential advantages, you might be asking, is disc replacement the correct procedure for me? First, LDR is almost never the first step. It's considered only after 6 months of non-surgical treatments have failed to give relief. The ideal candidate typically has chronic pain from 1 or 2 bad discs. They are also often younger and more active people. However, being a good candidate is just as much about the problems you don't have. Let's be clear about who is not suited for LDR. Those with major spinal instability, like scoliosis, are not candidates. The same is true for severe facet joint degeneration. Patients need good bone quality so the implant can anchor, so significant osteoporosis is a disqualifier. Smoking also increases risk. This is not a simple checklist. Candidacy requires detailed imaging and a deep evaluation by a qualified spine specialist. So how can you guarantee you have the most productive and informed conversation possible with your doctor? It comes down to shifting from a passive patient to an active partner. This starts by asking very specific, targeted questions. Question 1. Can you show me on my MRI the exact source of my pain and explain how this surgery will fix that specific problem? Question 2. What are the short and long-term risks for both procedures, and what is a realistic recovery timeline for me? Question 3. How many of this exact procedure do you perform each year, and what is your specialized training in it? And perhaps the most powerful question of all. Question 4. Do you perform both lumbar disc replacement and spinal fusion? Why is this so important? A surgeon skilled in both is better equipped to give an unbiased recommendation based on your anatomy, not their habit. Lumbar disc replacement is an advanced technology offering real benefits for the right patient. It is not a magic bullet, but a powerful tool. The path to relief is getting an accurate diagnosis and a personalized treatment plan from a physician who understands all the options. If you are in the Union, New Jersey area and are ready for that complete evaluation, the specialists at Hess Spine and Orthopedics are here to help. We have the expertise to determine if you are a candidate for LDR, fusion, or another treatment. Call our Union office to schedule a consultation. Do not let uncertainty manage your future. Take control of your health by getting the answers you deserve. Hess Spine and Orthopedics, Union, New Jersey. Phone number. Website. This video is for informational purposes only and does not constitute medical advice. Consult with a healthcare professional.